Today, I have not one, but two special guests who have written an amazing new book. You can see all the post-its, how good it is. It's called Body on Fire, How Inflammation Triggers Chronic Illness and the Tools We Have to Fight It. Their names are Dr. Monica Aggarwal and Dr. Jyothi Rao. And they're going to talk about their book and what brought them to write this book and maybe their stories too. So let's welcome both of them to the show. Thank you, doctors, so much for being here. And congratulations on having a book and being such an excellent book as well.
Oh, thanks so much for having us.
Thank you so much for having us.
It is my pleasure. It was actually recommended to me by your publisher because it said it was doing really well and I had to bump everybody up and get you guys on the show to talk about it. So what got you interested in writing a book on inflammation and really what is inflammation?
Monica.
Okay, so inflammation, so Jyothi and I are looking at each other like, am I supposed to take this one? Okay, so inflammation, I always think of inflammation and describe inflammation as your body's mad at you. It's when your body's irritation. And so whatever irritates you and irritates the body will manifest ultimately in inflammation in the body. And then eventually with long-term inflammation can cause chronic illness. So for instance, some of the things that trigger inflammation are stress, which is one of the biggest one, especially, and stress can manifest itself in many forms. It could be social stress, which is what most people think of when they think of stress, is sort of life stress, like work stress, or I had a really bad day at work, that kind of stuff. But stress can also manifest as sort of lack of activity or a sedentary lifestyle or poor diet, putting the wrong foods in your mouth, or noise pollution, sun pollution. And so all that stuff can sort of trigger inflammation in your body, which then sort of becomes a trigger for illness. You asked the second question you asked is how do we get into this? And Jyothi always tells the story maybe better than I do of how we started writing this book. I can tell you the background is that it's funny because I actually for years had a lot of trouble talking about it, but I have a chronic illness. And so I have advanced rheumatoid arthritis. And I was told when I was diagnosed after I had my third little munchkin, who's sitting right there, and that little munchkin, when she was born, after about 4 months of nursing, running around like a fool and being a full-time cardiologist and having 2 other kids under 4, I started manifesting this joint pain, which accelerated over a 2-week period from me being a runner to sort of being immobile. I remember days I just couldn't even climb up the steps. So I got really sick and was given sort of a lot of medications that gave me a lot of side effects, such as hair falling out, nausea and vomiting and diarrhea. I remember people telling me, wow, you lost all your baby weight so fast. And that was because I just couldn't eat. So getting sick is a interesting thing when you, especially as a physician. I think you become, the medications that you once prescribed to people and said, oh, there's only a 1 in 1,000 chance that you're going to have this problem. When you become the patient, you start realizing that you could be that 1 in 1,000. And so it started me on this path where I had a rheumatologist who told me that I will never be cured, that I just need to get used to it. And this is just the way life is. And so you get told that, and anyone who's as stubborn as I am would say, well, wait, there's got to be more to this. There's got to be more. Lifestyle's got to work. There's got to be things you can do. And I met a neat person who's a nutritionist named Karen Fick, who started me on this path to make me really think about how nutrition and lifestyle, and not just nutrition, but nutrition is a big component, but how stress impacts the body and triggers inflammation, and how maybe if genes get turned on by inflammation, and then there's a way to also suppress them. So on my own path to sort of getting better using these lifestyle techniques, I told Jyothi that we got to write a book about this, because Jyothi has her own interest, and I'm sure she'll tell you in a second about her interest in lifestyle-based medicine. And then we were off to the races.
Yeah, so I also had 23 years now in internal medicine practice, where I began just so frustrated with the practice of medicine after we both, Monica and I both trained at the New England Medical Center in Boston. separately, and we both came out thinking, we are so equipped to deal with patients' illnesses. And when I started practicing internal medicine, I became so frustrated so easily about the few little tools we had, and I felt like everything was always a Band-Aid. And so people really weren't healing. They were we're Band-Aiding it, and then we were giving a med which caused another problem, which it wasn't very satisfying at all. So I started searching for a path through integrative medicine. I became an acupuncturist. I started learning about nutrition on my own because my patients who employed nutritional changes, lifestyle changes, and even with acupuncture started to get better. For example, if I was treating carpal tunnel with acupuncture, they were getting better with their sleep. They were feeling happier. So I was like, what is this intervention that's causing so many positive changes? For example, a food plan that eliminates inflammatory foods can cause so many benefits in people, not just lowering their lipids or their cholesterol. So I think my journey has been trying to find these tools for my patients and myself to try to keep us kind of working optimally, trying to be as fit and well as we can without the use of multiple drugs all the time as my only intervention for patients. And I love my practice now because it involves a lot more incorporating education so that people can actually learn about how powerful it is, some of how these tools are so powerful, how we actually do have a lot of control over our health, how it's not determined by our genes alone. And I think it's very satisfying as a practitioner now to be able to let people know about these tools that we talk about in Body on Fire, because it is something that is so potentially life altering. And I think most people who have been on the journey with us, and Monica can agree for her story as well, that there's a lot of benefit that goes just beyond what we think might be cholesterol reduction or sugar reduction, blood pressure reduction. People just feel so much better.
So is it true that without inflammation, disease cannot exist?
I do think that most illnesses have a component of inflammation. I think most illnesses do, yes. Monica.
Yeah. So I think that that's true. So I think that inflammation is a big umbrella term, though. And so that's why I paused when you first asked the question, because inflammation is a response of your immune system to whatever trauma or something that affects it. And so you're always going to trigger the inflammatory cascade when you stress out the body. And so any kind of illness that comes into your body or any virus is also going to trigger that inflammatory cascade. Most of the time our body can treat it quickly and that inflammation dies back down. It's times of chronic inflammation that sort of more of the chronic illnesses manifest.
And so many habits of most Americans cause them to be chronically inflamed, right? Drinking alcohol, I would imagine, and smoking and not exercising and eating the standard American diet. These are all things that are inflammatory, right?
That's exactly right. So one of the things that the way to think, so we always sort of think about this scale. We put this in the book actually, and sort of say, okay, well, what are we doing wrong with our lives? And so in our lives, the demands on our body, things exactly like alcohol, but it's not that a little alcohol is a bad thing, but an excessive amount of alcohol coupled with all the salt in our diet. And again, not that I believe that some salt is a bad thing, but the